Did you know that blueberries, this tiny fruit packed with benefits, could be a serious problem if you take certain medications? Sounds strange, right? If you're over 50 and take medications like blood thinners or those to control blood pressure, this is an important warning for you. I'm Dr. Vitality, a specialist in healthy aging, and my mission is to help you live better and safer. Let's get to the bottom of this. Blueberries are often celebrated as superfoods, and for good reason. They're rich in antioxidants, such as anthocyanins, which fight free radicals and help prevent premature aging. Plus, these little blue fruits are known for improving memory, reducing the risk of heart disease, and even contributing to better eye health. It's no surprise that they're a top choice for those focused on a healthy diet, especially for people over 50. But as you'll see today, even the healthiest foods have their caveats. Studies from Harvard University have shown that regularly consuming blueberries is associated with up to a 20% reduction in the risk of heart attacks and strokes. Additionally, research indicates that the anthocyanins in blueberries have anti-inflammatory effects that can help combat chronic diseases. For those concerned about staying mentally sharp, blueberries are a smart choice as they enhance cognitive function and protect against age-related mental decline. But like everything in life, balance is key. Despite all these benefits, blueberries can become dangerous when consumed alongside certain medications. This happens because some compounds in blueberries, like flavonoids, can interfere with how medications are metabolized, leading to unexpected and even harmful effects. This is where things start to get serious. And before we continue, if you're finding this content helpful, go ahead and like the video and subscribe to the channel. That way, you'll always stay updated and help spread valuable information to more people. When we think about drug interactions, we don't usually link them to natural foods like blueberries. But the truth is, for those taking certain medications, especially blood thinners or blood pressure meds, blueberries can be a real complicator. This is because they interfere with hepatic metabolism, meaning how the liver processes these medications. This interference can either enhance or reduce the effectiveness of the meds, which can be dangerous. Let's start with blood thinners like warfarin. These medications are commonly prescribed to prevent clots and, in many cases, save lives. The problem is that the flavonoids in blueberries can amplify the effects of these drugs, making the blood thinner than it should be, which increases the risk of bleeding, including internal hemorrhages. Research published in the Journal of Clinical Pharmacology shows that this combination can significantly alter the therapeutic levels of the medication. Another example is blood pressure medications, like ACE inhibitors and beta blockers. Studies suggest that blueberries can intensify the effects of these drugs, potentially causing sudden drops in blood pressure, leading to dizziness, fainting, and in extreme cases, more serious complications. This is particularly relevant for those over 50, a stage in life where circulatory and blood pressure issues are more common. So the idea that the healthier, the better needs to be reconsidered when it comes to foods that interact with medications. Understanding these interactions is crucial for anyone who wants to live healthily without compromising their medical treatments. And often, the solution is simple: adjust your diet or talk to your doctor about how much blueberry you can safely consume. But that's not all. There are more important details on how blueberries can affect your health. Now that you understand the basics of dangerous interactions, let's talk about specific medications that can be impacted by blueberry consumption. Besides blood thinners and blood pressure meds, other common medications for older adults also make this list of concerns. For example, cholesterol-lowering drugs like statins can have their effects altered. This is because compounds in blueberries affect liver enzymes responsible for metabolizing these drugs, either enhancing or diminishing their effects. Another group of medications includes hypoglycemics, used by diabetics to control blood sugar levels. Research shows that blueberries can increase insulin sensitivity and, when combined with these drugs, may cause unwanted drops in glucose levels, resulting in hypoglycemic episodes. And anyone living with diabetes knows just how dangerous that can be. These examples highlight how something as seemingly harmless as a fruit can have a significant impact on your health, depending on what medications you're taking. And the worst part is that many of these effects aren't immediate, they can accumulate over time. So, if you're taking medication regularly and frequently eat blueberries, it's time to consider how to adjust this combination to avoid unpleasant surprises. It's also important to note that not all interactions are predictable. Depending on how many blueberries you consume and your metabolism, the effects can vary. This is precisely why we always emphasize the importance of discussing any dietary changes with your doctor, especially if you're on regular medication. After all, the goal is to keep your health in check without taking unnecessary risks. The side effects of interactions between blueberries and medications can range from mild to quite severe, and it's important to recognize them in time to take action. One of the most common effects, especially for those taking blood thinners, is an increased risk of bleeding. This can show up as something as simple as bleeding gums but can also escalate to more serious issues like internal hemorrhages. When this happens, it's a sign that the balance of the medication has been compromised. Additionally, those taking medication for high blood pressure may experience episodes of hypotension, or very low blood pressure. This issue can lead to dizziness, weakness, blurred vision, and even fainting. For those over 50, these episodes are even more dangerous because they increase the risk of falls and fractures. Studies show that sudden drops in blood pressure are more common in patients who don't adjust their diet according to their medical treatment. There's more. For diabetics, hypoglycemia is a constant concern. Since blueberries can intensify the action of medications that already control blood sugar levels, the result can be a sharp drop in glucose, which, if not treated quickly, leads to symptoms like tremors, excessive sweating, and even loss of consciousness. These risks are even more concerning when considering that nighttime hypoglycemia, for example, often goes unnoticed until the symptoms become severe. That's why the message is clear: consuming blueberries safely is possible, but it requires knowledge and attention. Small adjustments to your diet, like limiting the amount of blueberries consumed weekly, can make all the difference in your health. The key is never to underestimate the interactions between foods and medications, especially in stages of life where health care is a top priority. Now, let's get to the question on everyone's mind: can you keep eating blueberries without taking risks? The answer is yes, but with moderation and, of course, medical guidance. The first step is understanding that quantity matters. Eating a handful of blueberries occasionally probably won't cause problems. But if you consume large portions daily and are on long-term medication, you might want to reconsider that habit. A simple tip is to monitor how your body reacts. If you notice changes like more dizziness, bleeding gums, or blood pressure spikes, it could be a sign that blueberries are interfering with your treatment. Studies suggest that adjusting consumption to small weekly portions, mixed with other fruits, can be a safe way to continue enjoying the benefits of blueberries without risking your health. Of course, every case is different, and the final word should always come from your doctor. Another important point is to avoid eating blueberries during your main meals when you take your medications. Separating the consumption of the fruit from the medication intake can help minimize interaction risks. And if you love blueberries and don't want to give them up, talk to your doctor about possibly adjusting your medication dosage or exploring alternatives. Remember that healthy eating is a crucial part of aging well, but it needs to be done mindfully. Blueberries, when consumed in the right amounts and with the necessary precautions, remain a fantastic ally for health. With the right knowledge, you can get the best out of every food without compromising your safety or your medical treatment. As we've seen, even the healthiest foods can become complicated when we're not careful. Eating blueberries can bring numerous health benefits, but it's important to be cautious if you're on certain medications. The good news is that, with moderation and guidance, you can still enjoy this amazing fruit without putting your health at risk. Remember, knowledge is the key to living well and safely. And for those looking to take their health to the next level, check out the smoothie diet. Delicious and easy to make smoothies that promote rapid weight loss, boost energy, and enhance overall health. Click the link in the first pinned comment to learn more. I'll leave a video for you to watch that will complement what we discussed today. Don't miss it, because the information in it might be just what you need to keep improving your quality of life. I'm Dr. Vitality, and remember, health comes first.